Dr. Michael Nusbaum.
And I'm Dr. Daria Klachko, Totten.
And welcome to
Health Talks.
So what are we talking about today?
Well, let's spend some time talking about brain fog.
Big problem.
Big problem. So brain fog or cognitive impacts.
Brain fog in women.
Going in women, yes.
I'll explain ours later, but right now we're talking about women.
You'll get a turn.
Exactly.
So brain fog is a symptom of the menopausal transition, which can be hugely distressful, impacting relationships, work, self-esteem, and we commonly see some element of brain fog during the menopausal transition. So I kind of want to talk about that because it's something that can be really, really distressful. And I've noticed it myself. Never can find my keys. Where did I put my pocketbook? Always looking for everything. I'm sure there's a lot of people out there that can relate, like forgetting people's names, like embarrassing things that you ordinarily would never forget. Like you just kind of seem to not be able to get a hold on it.
So how are hormones affecting this loss of cognition?
So our sex hormones provide an anti-inflammatory effect on our brains. And that anti-inflammatory effect, it really helps keep the circulation going in our brains. It keeps our brains healthy and functioning well. Our brains, there's areas in our brains that are rich in estrogen receptors. And those modulate learning and memory and higher order functioning. So sometimes with the decrease in the sex hormones, estrogen, progesterone, and testosterone, this can really affect our brains and affect our cognition.
So does adding estrogen back in help?
Very good question. So, the research done on this is kind of conflicting, which is kind of like you think if you add it back, it would automatically be okay. We do see that there is some benefit to estrogen brain fog. By adding it back, but it might be multifactorial because a lot of people who are going through the transition are hot flushing, they're not sleeping well, they have, all this can lead to mood disturbances. So by adding back the estrogen, it can help, people sleep more, not disturbed by the hot flashes all the time, and a whole snowball effect can just make everything kind of better. So we do see some benefits with adding back estrogen.
Is there anything else that can be done to help with the brain fog?
Yes, as a matter of fact. I mean, the good news is most of the time, even left alone, it'll get better. I noticed that with myself. It's so much better. With lifestyle modifications can really help.
So is this just perimenopause in the beginning of menopause and it gets better later on?
So this is through what we call the menopause transition. So this is when, most women are still menstruating, but maybe the periods are getting more irregular, and a lot of the symptoms, because of your hormones are fluctuating, your body's not used to those dives down of hormone so it kind of triggers these symptoms. Most women, once they're through this time, which can last months for lucky women, but can also last years, most women, when they're on the other side now, postmenopausal, a lot of these symptoms will get better. So what else can we do? So, definitely adopting a clean, healthy lifestyle will help in every aspect of our lives, but can be very beneficial, for brain fog as well. So, eating well, incorporating omega-3 fatty acids in your diet. The Mediterranean diet is really something that seems to be very helpful for brain fog. Also, keeping your social network going, making sure that you go out. If you're invited to a party, go to the party, go to the party, keep your friends, keep your social network going. That helps you in the long run as far as cognition.
What about the effects of smoking and alcohol?
Well, of course that's not good, right? So if you're smoking, really work to stop smoking. It's just bad for you in
smoking
every
is going to
aspect.
damage all the small vessels anyway, so then it's going to contract some of the vessels. So, that in many ways is a terrible thing to be doing.
Yes. So it's bad all around, and yes, you can help your brain fog and cognition by stopping smoking and certainly don't start smoking, don't start smoking. And reduction in alcohol is really good as well.
What about exercise?
Exercise is the most important.
Okay.
So keeping active physically certainly is the most important. That seems to help the most. Getting on an exercise routine, making sure you make it part of your daily routine, you're part of your job, incorporating into your lifestyle is so important, not just for brain fog, but for everything else.
Even if you start off with just a couple minutes a day and then work your way up, but sometimes it's getting started that's the hardest part. So if you can just squeeze in a little bit of exercise, just a couple minutes every day, and then build on that, that's the best way to get started.
Graduate your program.
There's
a lot of experts out there that can help you if you need help. There's videos, you can look into that, but keep moving. It's so important, as well as being mentally challenged. If there's, read, make sure you keep up with the latest information that's out there, keep your brain active, and that really helps as well. There's going to be a normal amount of brain fog during aging as well as during the transition. But if you see in yourself or in a loved one that it seems a little bit worse than would be expected, that would require, getting some help and kind of just evaluating it to make sure that these are not
see
just
a specialist.
Changes. Right. Yeah. See a specialist, a neurologist, or you can start with your general practitioner to say, like, I think, something that's going on is a bit more than what would be expected, just, from the menopausal changes.
Absolutely. Any takeaways?
Takeaways is take care of yourself, eat healthy, exercise, and motivate yourself to take the best care of yourself and get the help you need. Advocate for yourself. When you go see your doc, talk to them. Don't hide anything. Let them know and seek that help.
Absolutely. Thank you. Well, I'm Dr. Michael Nusbaum.
Dr. Daria Klachko Totten.
And thanks for joining us at HealthTalks.
Thank you so much.
Thank you.